welcome to the first annual Recovery Centers of America Massachusetts Legislative Breakfast.
There is a law called parity. It's a federal law. The federal law says that patients who have diseases above the neck have to be treated exactly the same as patients who have diseases below the neck. Exactly.
For decades, there was a societal value that people with addiction and mental health problems were separate and that they were not facing a disease, that it had many of the features of lack of willpower or bad character.
I mean, most people that are drug addicts aren't bad people. You know what I mean? Like, I grew up and went to high school, I went to college, and I was actually studying criminal justice in college, and that kind of took a turn. But I mean, like I said, I didn't grow up to shoot heroin. I just didn't. And
we are losing an entire generation of people out there that is killing so many families, and this is 100% preventable, and I'm fed up. And I know a lot of people in this room are fed up as well.
The insurance industry developed a way of dealing with behavioral health issues that had them very separate from the rest of healthcare. So if you had a policy, you'd see the behavioral health care stashed back on page 13 of the policy.
Imagine for a minute, 25 breast cancer patients go into the hospital knowing they have breast cancer, needing immediate treatment, and they're told at the front door, sorry, we're not going to approve your treatment today. And by the way, call us tomorrow and we'll think about it. How many riots would be in the streets of Boston or every city in the country?
This is sort of an opportunity for us to get to know each other and for us to, from Recovery Centers of America, to introduce ourselves to you and also to become a resource for you. There's a lot going on in Massachusetts, there's a lot going on in our country in terms of addiction, and particularly, I think, the lack of adequate treatment.
Death from overdose is now the largest cause of accidental death in the United States, way more than car accidents. We have MAD, Mothers Against Drunk Driving. Why don't we have MAD, or even better, MAID, Mothers Against Insurance Denial? We're in this business because we care, because we want to intensely solve this opioid problem. And whether or not I make a nickel, I don't give a damn. But I want to change the world of addiction, and we need your help, and everybody in this room needs your help.
And frankly, there's no basis in fact to treat one organ in the body differently than all the other organs in the body, and that organ is the brain. So people with brain diseases deserve to be treated just like other diseases in the body.
Treat our patients the same as every other patient. Use cancer as a standard. Give our patients access to treatment on the same level. Our philosophy, people who are treated well get well faster, stay well longer. By the way, proven science. Take a patient, treat them with dignity, put them in a nice place, and they relax. And they open their mind. And they say, you know, my bathroom's great, the food's great, the people are great, the building's great, it's new, my shower's nice. Maybe I'm important. And if I'm important, maybe I should live. In order to live, I got to open my mind to addiction treatments.
the staff like cares, you know what I mean? They don't look at you. It's not just a paycheck. They don't go in there and I don't know, do their job. It's like more personal for them. And
Because ultimately, it's all about helping someone achieve a sense of self-worth. Learning how to love yourself and care about yourself and appreciate yourself is so important in your process of achieving recovery. And you know, as a person in long-term recovery myself, I've been to the facilities that treat you as if you're not worth anything. And guess what? You leave there feeling like you're not worth anything. And that's not good for anybody. It's not good for the individual. It's not good for their family. And it's not good for us as a community or as a state.
It's really impressive what they're doing. They're bringing a hammer to this fight. You know, definitely, like you mentioned, howitzer. So this is a real issue that we battle every single day, and it's great to see somebody really take this seriously and try to make a real palpable change in the battle.
whole purpose of parity. It's not to mandate coverage for addiction and mental health. It's simply to say, whatever you do on the medical side, the cost control techniques that you use on the behavioral side have to be comparable and no more stringent than. That's the language in the regulations.
I think I've lost in the past 6 months 20 people I like have known, or 20 to 25 people have overdosed that I was like in contact with and friends with at a period of time. And
We look forward to working with you on common sense legislation, effective legislation to address the opiate crisis that we're experiencing here in Massachusetts. We look forward to being a partner in the state's response to that.
I encourage you to think about the scale of justice. We need to pass legislation in this state. Not unique legislation, just legislation that enforces the federal laws that already exist. Thank you very much.